Hi friends, today our topic is ventilator, control modes and patient modes. We would like to explain about ventilator modes. This is patient ventilator modes. This is having two type control modes. One is patient control modes. Second is ventilator control modes. These modes are patient control modes, volume control mode, SIMV mode. In SIMV again two modes, pressure support and volume control. PSC pressure support. This is pressure spontaneous support. SIMV synchronized intermittent mandatory ventilation. SIMV mode having pressure support and volume control, and volume support, pressure control also is there. This is PSV. Next CPAP. Another one PRVC. These are patient control modes. And machine control modes: invasive and non-invasive. In invasive again adult, pediatric, neonatal. So in the both non-invasive and invasive controls or settings will be available: adult mode, pediatric mode and neonatal mode. In PRVC mode, it is pressure regulator volume control. Actually another mode is available, that is PVRC, pressure regulator volume control, pressure regulated PCVR. This is pressure control, volume regulates. Here pressure regulates, volume control. This is for adult mode, but this is for neonatal mode. Neonatal patients, so it will recover lungs oxygen absorption and lungs activity faster. This is volume control mode or assistant AC mode also. Assist control mode also we called as. So pressure support, volume support. SIMV mode having spontaneous intermittent mandatory ventilation, pressure support and volume control. Both modes are there in this. So when we are unable to breathe, the patient will be admitted in ICU. Then they connected the ventilator and they will connect as per the patient condition. They choose the options of these modes: 1, 2, 3, 4, 5, 6, 7. And CPAP having BiPAP mode. So here either CPAP or BiPAP you can select. So when patient is connected and CPAP mode, is ready to discharge in 1 to 2 days or 3 days max, like that. That is depend upon the doctor how he is going to discharge, and how the patient condition. If patient condition again worse after CPAP also, then he will come to the back. Will come back to the connecting of other modes, means SMV or PRVC or PSV, pressure support ventilation, whatever it is. So these are the main modes in the ventilator. And manual mode also there presently, but it's not mandatory. There is a MV mode. This is manual ventilation mode. Nowadays nobody using this because all automatic modes are active in all the ventilators. Thank you.